the bladder, more frequent urination, difficulties, and people don't need to take prolonged. Another problem is that if a person genetically predisposed.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopathic Dr. Fiona Chin, co-founder of Kidney Disease Solution, Kidney Coach, and our flagship products from Kygenesis. And I'm joined again today by one of my favorite guests, Dr. Alexander Grinberg. Dr. Grinberg is hello. I'm always so glad when you join me. Dr. Grinberg is a practicing physician up there in San Francisco in the US, working with patients in the area of longevity, lifespan, extension, personalized anti-aging, nutritional optimization, lifestyle medicine. So very, very holistic in what he does. He's not only a practicing MD, but he's also got a background in virology. He's also got psychiatry background. He started his medical degree when he was 16, which is just crazy for me. So he's been doing, this is what he's dedicated his life to. In fact, Alex, I think we'd spoken about that you became almost obsessed with longevity and anti-aging from like the age of like 6 or something. So you've really, this has been your life work. Let's dig into what happens in menopause. What is that process that as women joyfully get to go through, and what happens in that? And then walk me through potentially the connection to chronic kidney disease from there.
So I'll briefly give some formal definition, formal knowledge, and we can proceed to very exciting things that can hopefully benefit everyone. So formally menopause means the 12 months, absence of periods for 12 months, and a raise of the levels of FSH, follicle stimulating hormone. This is basic medical definition of menopause.
So women that go on HRT will improve their kidney function if they've already got a decline in EGFR.
Yes, and there were no specific large-scale studies on that, but to kind of break it down to what factors contribute to this. For example, estrogen helps women to prevent UTI, as it helps to maintain health and intactness of urinary tracts. And then women with menopause and the postmenopause know well that they frequently have changes in the muscle system of their bladder, more frequent urination, difficulties holding urine. It's all, many of these symptoms actually resolve with HRT. And OBGYN doctors report that sometimes they treat 90-year-old woman with worsening UTI, urinary incontinence with estrogen, or specific creams containing estrogen and progestins, with very good results, and people don't need to take prolonged and high amounts of antibiotics. And antibiotics are not so friendly to kidney as well. So we treat UTI, and we can definitely aggravate pre-existing or create new renal problems. So this is one factor why women with menopause may develop worsening urogenital condition and urological and nephrological problems. Another problem is that if a person genetically predisposed to atherosclerosis and arterial calcification, either CKD can aggravate these problems, but if we look primarily on menopause without pre-existing CKD, a rapid deterioration of lipid balance, and as estrogen helps to maintain healthy lipid state in the body, and prevents development of atherosclerosis and cholesterol depositions. Again, if someone genetically predisposed to early arterial lipid depositions and rapid calcification, definitely kidney, very delicate glomerular blood vessels may be first target for this assault done by increased levels of lipids and rapid calcification, because next target would be parathyroid gland. It's also related. Everyone knows that we need to check PTH, parathyroid hormone level, in people with kidney problems. It's one of the markers or factors that helps to also assess the efficiency of treatment. Is very important. But again, there are connections between estrogen and parathyroid gland, connections between estrogen and connection is very simple, as estrogens, as kidney regulate levels of electrolytes and changes of electrolytes and particular calcium and phosphates levels target or trigger release of parathyroid hormone to reverse related hypocalcemia, low levels of calcium. And if for people with chronic kidney disease, active resorption of calcium is extremely dangerous. First, it takes calcium from there already more fragile than general population bones. And second, it increases levels of calcium, and where calcium comes, the phosphates come, and it increases the toxic load or the load of substances to be eliminated by kidneys, and definitely any pre-existing kidney problem or kidney problem aggravated by lack of estrogen related to menopause makes them more vulnerable to this complex phosphate calcium PTH interactions.
Dr. Grinberg, thank you so much. Now, if anyone wants to contact you, infinityepigenetics.com, I'll put the link below. Dr. Grinberg is in San Francisco, but he does telehealth, because I send my really complicated patients in Australia here to him. So wherever you are in the world, he can definitely work with you. Like I say, one of the most knowledgeable people when it comes to peptides. So if I've got any patient where I'm like, they need a complicated peptide protocol, I'm sending them to Dr. Grinberg. So if you want to know more about what we do, please head to www.kidneycoach.com. You'll also find us on Instagram and Facebook under the same bits of information. Remember to hit subscribe and like. That way you'll get notified anytime we put up more information. And if you have questions for Dr. Grinberg, please put them in the comments section below and I will get them to him and answer them for you all. Dr. Grinberg, thank you so much for your knowledge, your time, and your wisdom. This has been a really informative and great podcast, and hopefully we'll answer all those questions that my menopausal women have had when it comes to CKD and kidney disease.